So we have a 97% satisfaction or retention rate with our Medicare Advantage plans, which is large. I believe the national average is roughly 83%-ish as far as voluntary retention rates. So basically what this means is our members stay with us. So we take really good care of them. We have excellent customer service. So year over year, we tend to have minimal voluntary disenrollments from our plan, which is key because we know if we keep our members satisfied, it's less kind of hassle for the agent, if you will, in trying to deal with health plan issues. I'm not saying we are perfect, but I'm saying that we have excellent customer service and we are known for that. So let's talk a little bit about the plan designs that we have. And again, these are 2025 plans. Benefits/plans will change ever so slightly for 2026, but as I said previously, I'm not able to share those benefits yet. But we do have quite a few products. We have about 7 products total in our Medicare Advantage portfolio. I'm going to go ahead and talk about our HMO plan designs first. So as you can see here, we have 5 HMO plans that we currently offer. Excuse me. We have our Amber plan here to the left of the screen, which is a Medicare Advantage only. What that means is it doesn't have prescription drug coverage with it. It's just an MA only medical coverage. We offer that at a 0 premium. And then we have Medicare Advantage prescription drug plans. We have 4 of those. Those do include Part D coverage, prescription coverage. So you can see the premiums for our various plans. As I said, Amber starts at 0, or Amber is 0. We then have our Topaz HMO, which is at 0. We have our Jade HMO plan, which is $12. These are monthly premiums. We have the Garnet for $24, and then we have the Ruby plan for $48. So to go into a little bit of detail with each of these plans, our Amber HMO plan, as I mentioned, is an MA only plan, does not include prescription drugs. We know those plans are attractive to veterans, for example, who may get their, through the VA, they get coverage for prescription drugs, so they really don't need prescription drugs if they're adding Medicare Advantage plan. A Medicare Advantage plan to their coverage, they don't need those prescription drugs. So those are good for veterans. You can see high-level benefits. There's a $34.50 maximum out-of-pocket. All of our plans feature a zero copay for in-network PCP benefits or office visits. So you can see that benefit listed here. All of our plans include dental coverage. This particular plan has $2,000 a year in annual dental coverage. We have $100 OTC benefit, which is $25 per quarter. I'm sorry, $100 for our Amber 1 plan and $25 for Amber 2 for OTC. I should mention the difference between the Amber 1 and Amber 2 is just the service area. Some of our plans, I believe it's 2 to 3, it's not all of our plans, have slightly different benefits depending upon the county that the product is offered in. Amber is one of those that has slightly different benefits depending upon the Toledo region, for example, versus the Akron-Canton region. So some of our plans in the materials, you'll see a 1 and 2 version of those plans. That's what that means. You want to pay attention to the county that you're looking at for the benefits. If I go into the Topaz plan, excuse me, it is our most popular plan. So this is our 0 premium plan that includes prescription drugs. It's an MAPD plan. For 2025, there is a $2.20 Part B buyback with that, meaning that members get a $2.20 credit to their Part B premium. That isn't something that was planned. That's something that kind of came out in the benefit negotiation with Topaz. It just worked out that for 2025, we were able to offer that $2.20 buyback on this particular 0 premium plan. For the Topaz plan, there's a $4,000 maximum out of pocket. You can see our 0 PCP copay, $35 specialists on that plan. It does feature a $3,000 annual dental coverage benefit with it. For 2025, we're able to offer a $90 per quarter over-the-counter benefit. And I'll talk a little bit more about that on the next slide. This plan includes vision hardware. It includes transportation. It also includes the PAPA plan, which is a kind of like a companion care program. I'll talk about that in a minute too. For this particular plan, the Topaz plan, it also features a $0 copay on tiers 1, 2, and 6 Part D drugs. So you can sort of see why it's our most popular plan. So for the Topaz plan, as I mentioned, it has that $90 per quarter OTC benefit. For 2025, we're also offering the flexibility to use that benefit for healthy groceries as well. Now, the member does have to qualify and have an SSBCI diagnosis, meaning they have to have a certain chronic condition for them to be able to qualify to utilize their OTC for groceries as well. There are about 25 diagnoses that are eligible for this benefit. You can see them down here at the bottom. They're your typical ones like diabetes, congestive heart failure, et cetera, et cetera. But if a member qualifies, has one of those conditions, they can take that $90 per quarter over-the-counter benefit and determine if they want to use it all for over-the-counter or if they want to use some of it for groceries or all of it for groceries, but they are eligible to do it if they have one of those SSBCI conditions. Moving on to our Jade HMO plan. This is a fairly new plan that we've offered for about the last 3 years.